Welcome to the Medi-Cal Pediatric Integration webinar. Let's take a look at our agenda for today. Today, we will discuss pediatric integration and New Start versus continuation of therapy claims. Then, we will discuss the CCS panel authority policy. Additionally, we will review helpful Medi-Cal resources such as the CDL, covered products list, and approved NDC list. Next, we will discuss common reject codes and how to resolve them, along with applicable case studies. And lastly, we will review some helpful contacts and resources. Now let's dive into pediatric integration. Medi-Cal Pediatric Integration aims to integrate the pediatric population into the Medi-Cal Utilization Management Program by implementing pediatric appropriate policies and operational workflow. The foundation of the implementation of this plan is focused on stakeholder feedback and preparedness, performance monitoring, and nimble adjustments. This purpose aligns us with our objectives to reduce disruption as well as ensure safe and timely delivery of pharmacy benefits. Now, let's take a deeper look into what has been implemented for members 21 years of age and younger. As of January 31st, Medi-Cal has implemented claim utilization management edits and prior authorization requirements for members 21 years of age and younger for New Start claims. Continuation of therapy claims will not deny with Reject Code 75, prior authorization required, for a period of no less than 60 days from January 31st. All other claim edits will apply, which could still result in a PA being required in some cases. Note, Medi-Cal will provide at least 30 days notice to stakeholders prior to the reinstatement of Reject Code 75 for continuation of therapy claims. We will discuss the difference between New Start and continuation of therapy claims in more detail in our next section. Additionally, pharmacy providers and prescribers may proactively submit PA requests up to 100 days in advance of New Start therapy or PA expiration for members 1 year of age and older. Please note, due to potential rapid changes in an infant's health status, PA requests for children younger than 1 year of age should be submitted with the prescription. Medi-Cal has also implemented the California Children's Services Panel Authority Policy for CCS panel providers who are physicians or certified nurse practitioners and enrolled in Medi-Cal. We will go into more detail regarding CCS panel authority in a later section. Now, let's talk about New Start versus continuation of therapy claims. While there are other aspects to pediatric integration, this slide will focus exclusively on the differences between New Start therapy claims and continuation of therapy claims. We aim to provide a clear explanation of these differences and what has been implemented for members 21 years of age and younger as of January 31st. Let's start with New Start therapy claims. New starts are defined as new to therapy or an absence of paid claims in the past 15 months prior to the current claim's date of service. These claims apply to members 21 years of age and younger and will be subject to all Medi-Cal claim edits and PA requirements. Now, moving on to continuation of therapy claims. Continuation of therapy claims are defined as claims submitted for an NDC of the same drug or product found in previous paid claims within 15 months prior to the current claim's date of service. These claims also apply to members 21 years of age and younger. For at least 60 days, if a claim would otherwise reject with Reject Code 75, prior authorization required, but the Medi-Cal member has recent claims history, the claim will pay without the need for an additional PA. This approach is intended to give providers and prescribers additional time to adjust their internal processes and better plan for pediatric integration requirements, as well as submit proactive PAs. Medi-Cal Rx will provide at least 30 days notice to stakeholders before reinstating Reject Code 75 for continuation of therapy claims. Please note, while Reject 75 is not currently applicable, these claims will be subject to all other Medi-Cal Rx claim edits. In summary, new start therapy claims will be subject to all Medi-Cal Rx requirements, while continuation of therapy claims will have a temporary exemption from Reject Code 75, but all other Medi-Cal Rx claim edits will apply. We will now switch gears and discuss the CCS panel authority policy. CCS panel providers who are licensed to prescribe medications and are Medi-Cal enrolled will be granted prescribing authority for all pediatric members treated by these panel providers. As of January 31st, Medi-Cal Rx has implemented the CCS panel authority policy, in which CCS panel providers who are physicians or certified nurse practitioners will have authority to prescribe for members 20 years of age and younger without submitting a PA for Medi-Cal Rx covered drugs and products, with some exceptions. The CCS panel authority policy covers the PA requirement when the following conditions are met. The member is 20 years of age or younger. The prescription is written by a member's physician or certified nurse practitioner who has CCS panel authority, and the claim denies with one of the following reject codes. Reject code 75, prior authorization required, some exceptions apply, or Reject Code 83, duplicate paid captured claim, when submitted for enteral nutrition products. Please note that all other rejects will apply. The CCS panel authority policy will apply to medications and supplies on the Medi-Cal Rx contract drugs list, with some exceptions. Pharmacy providers and prescribers are encouraged to utilize the Medi-Cal Rx CDL and covered products lists when prescribing. Now, let's move on to our next section to discuss these lists. The Medi-Cal Rx contract drugs list, covered products list, and approved NDC list are available to assist all pharmacy providers and prescribers, including prescribers with CCS panel authority. Let's begin with the covered products lists. To determine drug and product coverage, refer to the CDL and covered products list available on the Medi-Cal Rx provider portal under Forms and Information, which are updated monthly. These lists provide detailed information regarding drugs and products that are eligible for coverage and reimbursement under Medi-Cal Rx, including coverage restrictions, reducing the need for PAs. The CDL is searchable by generic name and is alphabetized by therapeutic class. Drugs not found on the CDL require a PA. Drugs and products found on the CDL are also subject to utilization management type Code 1 restrictions, such as those listed on the slide. Additionally, covered products may have quantity limits not listed on the CDL that are reflective of sound clinical practices and FDA-approved dosing. Pharmacy providers and prescribers can proactively review the Medi-Cal Rx approved NDC list for information regarding drugs and products eligible for coverage under Medi-Cal Rx as a pharmacy benefit. The approved Medi-Cal Rx NDC list can be found on the Medi-Cal Rx provider portal and is viewable as an Excel file. This list can be filtered and sorted by generic and brand name and is searchable by NDC. The NDC list will also indicate PA requirements by NDC. Now, let's discuss how the approved NDC list can be utilized for providers with CCS panel authority. On January 22nd, a detailed list of products included and excluded from the CCS panel authority policy by NDC has been updated to the Medi-Cal Rx approved NDC list. This list will be updated monthly, and drugs or products excluded from the CCS panel authority policy will require a PA unless eligible to bypass Reject Code 75 under the continuation of therapy policy. CCS panel providers are encouraged to review the Medi-Cal Rx approved NDC list to determine which drugs or products will be subject to PA requirements and plan accordingly to access therapy for members. Now, let's discuss how to resolve some common rejects. Let's go over some of the most common reject codes that providers may encounter when submitting claims for members 21 years of age and younger. Common rejects that may apply when submitting claims to Medi-Cal Rx include, but are not limited to, reject codes 75, 76, 78, 80, 83, and 606. Please note, for a more detailed list of claim requirements, refer to the Medi-Cal Rx Provider Manual and the claim submission reminders linked on this slide. Next, let's go into more detail on these reject codes. If claims return with Reject Code 75 PA required, providers can review the CDL and determine if alternate therapy is appropriate. If covered alternative therapy is not appropriate, providers can submit a PA request. Please note, as previously discussed, continuation of therapy claims will temporarily not be subject to Reject Code 75 for at least 60 days from January 31st for members 21 years of age and younger, and Medi-Cal Rx will provide at least 30 days notice prior to the reinstatement of Reject Code 75 for continuation of therapy claims. Also, as discussed earlier, prescriptions submitted by CCS panel providers will be exempt from Reject Code 75, prior authorization required, unless identified as an excluded medication or product. Other edits, including quantity limits, will apply. As of January 31st, Reject Code 76 has been implemented for members 21 years of age and younger. Reject Code 76 messaging informs providers of quantity limitations for maximum days supply and quantity days supply. To help resolve Reject 76, providers are encouraged to review quantity limit requirements on the CDL, the specific manufacturer's prescribing information, and FDA approved dosing. If resubmission of the claim to meet quantity limits is not appropriate, a prior authorization is required for coverage consideration. Point of sale overrides are not available. When applicable, submit a PA request via one of the 5 approved Medi-Cal Rx PA submission methods. For more detailed information, refer to the How to Resolve Reject Code 76 alert linked on this slide. As of January 31st, Reject Code 78 has been implemented for members 21 years of age and younger. If Reject Code 78 cost exceeds maximum is received, providers should confirm the claim is submitted accurately and validate the prescription's quantity and day supply amount is correct. Consider prescribing a less costly therapy if clinically appropriate, or if a change in therapy is not appropriate, submit a PA request via one of the 5 approved Medi-Cal Rx PA submission methods. Please note, this policy will apply when POS pharmacy claims exceeds the dollar claim amount threshold and will reject 78 with supplemental messaging. For more detailed information on how to resolve Reject Code 78, refer to the How to Resolve Claim Reject Code 78 alert linked on this slide. As of January 31st, Reject Code 80 has been implemented for members 21 years of age and younger. If the Code 1 diagnosis requirement is not met, claims submitted to Medi-Cal Rx will deny Reject Code 80 with supplemental messaging. Prescription documentation requirements apply to Code 1 diagnosis restricted drugs. Pharmacy providers and prescribers must document the treatment diagnosis and keep that information readily available for auditing purposes. For more detailed information on how to resolve Reject Code 80, Refer to the How to Resolve Reject Code 80 alert linked on this slide. As of January 31st, Reject Code 83 has been implemented for members 21 years of age and younger, with exceptions. Reject Code 83, duplicate paid captured claim, occurs when more than one claim is submitted for the same member, drug, and date of service, in which the first claim paid and the second claim is captured as a duplicate transaction. For more detailed steps on how to resolve Reject Code 83, review the Reject Code 83 Duplicate Paid Captured Claim Alert linked here. Please note, as mentioned earlier, CCS Panel Authority Policy covers the PA requirement for Reject Code 83 when submitted for enteral nutrition products. As of January 31st, Reject Code 606 has been implemented for members 21 years of age and younger. Reject Code 606, Brand Drug Specific Labeler Code Required, reinstates Labeler Code requirements on brand multi-source drugs. Code 1 labeler restrictions can be found on the CDL, as well as in the supplemental message returned upon claim adjudication. Reject Code 606 requires submission and approval of a prior authorization to receive a paid claim with Medi-Cal Rx. Next, let's discuss how to submit PAs to Medi-Cal Rx. PA requests can be submitted via one of the 5 approved Medi-Cal Rx submission methods: Cover My Meds, Medi-Cal Rx Secured Provider Portal, NCPDP P4 Transaction, fax, and U.S. mail. As discussed previously, pharmacy providers and prescribers can submit PA requests up to 100 days prior to the start of therapy, or PA request expiration for members 1 year of age and older. Due to potential rapid changes in an infant's health status, PA requests for children younger than 1 year of age should be submitted with the prescription. Members with an approved PA request will remain active through its approved length of authorization. Next, let's take a look at some case studies and how some of these common reject codes interact with CCS panel authority and pediatric integration. In our first case study, we have a CCS member who is 9 years old. This member is about to begin a new start therapy. The member's doctor, Dr. Smith, is not a CCS panel provider, and therefore the CCS panel authority policy is not applicable. When prescribing, Dr. Smith reviews the CDL and sees the medication has Code 1 restrictions and proceeds to review the diagnosis crosswalk to provide a clinically appropriate diagnosis code with the prescription. When ABC Pharmacy receives the prescription, they submit a claim to Medi-Cal Rx and receive Reject Code 80 for diagnosis required. Dr. Smith already provided the diagnosis with the prescription, so the pharmacy inputs the applicable diagnosis code and resubmits the claim to receive a paid claim. In our second case study, we have a CCS member who is 16 years old receiving a new prescription for a continuation of therapy. The medication is an excluded product from the CCS panel authority policy and requires a PA and will return with Reject Code 75. Our prescriber, Dr. Smith, is a CCS panel provider, but CCS panel authority policy is not applicable in this scenario because the medication is excluded from CCS panel authority. Dr. Smith has reviewed Medi-Cal Rx resources and identified that this drug would require a prior authorization. As previously discussed, for a period of at least 60 days from January 31st, a PA for Reject Code 75 will not be required for continuation of therapy claims. ABC Pharmacy submits the claim to Medi-Cal Rx and receives a paid claim because continuation of therapy claims will not deny with Reject Code 75 at this time. Medi-Cal Rx would like to remind providers and prescribers that in situations such as this and others,
they are encouraged to submit a proactive PA up to 100 days in advance of New Start therapy or PA expiration for members 1 year of age and older beginning January 31st. Medi-Cal RX will provide at least 30 days notice prior to reinstatement of Reject Code 75 for continuation of therapy claims. In this study, we have a CCS member who is 20 years old and is receiving a new prescription for a continuation of therapy for an enteral nutrition product. Dr. Smith is not a CCS panel provider, and therefore the CCS panel authority policy is not applicable. ABC Pharmacy submits claims for two different flavors of the enteral nutrition product and receives reject code 83 for a duplicate claim. Even though the member is receiving a continuation of therapy and reject code 75 is not applicable at this time, all other claim edits do apply, including but not limited to reject code 83. ABC Pharmacy calls the Medi-Cal RX Customer Service Center to resolve the issue or, if applicable, submits a PA for the two flavors. In this scenario, Dr. Smith did not have CCS panel authority. As discussed earlier, CCS panel authority would apply to reject code 83 in this situation, and ABC Pharmacy would not have received a reject had Dr. Smith had panel authority. In this study, we have a non-CCS member who is 2 years old and receiving a continuation of therapy for a drug that requires a PA and would normally return with reject code 75. Our member's prescriber, Dr. Smith, is CCS panel provider, and the CCS panel authority policy is applicable. Even though our member is not a CCS member, Dr. Smith's panel authority will still apply. As we saw in our second case study, for a period of at least 60 days from January 31st, a PA for reject code 75 will not be required for continuation of therapy claims, and ABC Pharmacy will receive a paid claim. An important note for this study, however, is that Dr. Smith's panel authority would also allow the claim to pay without receiving reject code 75. We would like to again remind providers and prescribers that in situations such as this and others, they are encouraged to submit a proactive PA up to 100 days in advance of New Start therapy or PA expiration for members 1 year of age and older, beginning January 31st. Medi-Cal RX will provide at least 30 days notice prior to reinstatement of reject code 75 for continuation of therapy claims. In this study, we have a CCS member who is 21 years old and starting a new therapy for a drug that requires a PA and will reject with reject code 75. Prescriber, Dr. Smith, is a CCS panel provider, but the CCS panel authority policy is not applicable due to the member's age. Even though Dr. Smith has panel authority, which allows claims to not reject with reject code 75, it is not applicable to this claim. As we discussed earlier, CCS panel authority only applies to members 20 years of age and younger, and since our member is 21, CCS panel authority will not apply. ABC Pharmacy submits the claim to Medi-Cal RX and receives reject code 75 and will need to submit a PA request. In our last study, we want to look at a claim for a newborn member. We will first discuss PA requirements, then discuss how to submit claims for newborns to ensure they are processed properly. This newborn member is receiving a New Start therapy for a medication that requires a PA and would normally return with reject code 75. This member's prescriber, Dr. Smith, is a CCS panel provider, and the CCS panel authority policy is applicable. ABC Pharmacy would submit the claim to Medi-Cal Rx and receive a paid claim because Dr. Smith's CCS panel authority allows claims to pay without returning reject code 75. Now, for the newborn part of submitting claims. For Medi-Cal and CCS eligible members, newborn members will be covered under the mother's Medi-Cal Rx ID for the first month of birth to the end of the following month, up to 60 days. Claims for newborns will be identified via the relationship code and PA type code. A relationship code value of 3 dependent and a PA type code value of 8 will identify the member as a newborn on a claim.
If the pharmacy appropriately identifies the claim as a newborn, the CCS panel provider authority policy will apply and the claim will be processed with an appropriate age. If the claim is not appropriately identified as a newborn, the claim will be processed using the mother's age and CCS panel authority policy will not apply. Now, before we conclude our presentation, we want to provide you with some important contacts and resources. On this slide, we have provided a list of available Medi-Cal Rx Pediatric Integration resources. These resources can also be found on the Medi-Cal Rx provider portal on the Education and Outreach page by selecting the Pediatric Integration tab on the left. Here are available Medi-Cal Rx resources, including PA resources, CDL, and enteral nutrition resources. Allow these resources to come to you. Sign up for the Medi-Cal Rx subscription service so you can receive future alerts directly to your inbox. Here, we have included helpful links to efficiently navigate through Medi-Cal Rx resources. But the most important message we want you to take away from today is that the Medi-Cal Rx team is here for you. We encourage you to review our website and its extensive resources, or for additional questions or to schedule a one-on-one office hour via Microsoft Teams meeting, email the Education and Outreach team at medicaloutreach@primetherapeutics.com. Also, our customer service center is available 24 hours a day, 7 days a week, 365 days a year to provide around-the-clock support. Again, we encourage you to sign up for our subscription service, which will provide emails directly to your inbox regarding Medi-Cal Rx updates. Here, we have included available CCS resources available to you. And that concludes our webinar. Thank you.